GI surgery. So today my topic is colorectal cancer, which is a very important topic. So I know you all are from medical audience, but let me ask a general question. How many of you have had family members or friends who have been diagnosed with colorectal cancer? Hands up, please. Yeah. So that shows that the disease itself is very common. So moving on to the objectives. So we have a few objectives. So we should know what is the impact of the colorectal cancer and the common sites of colorectal cancer and the associated symptomatology. And finally, I will move on to the diagnosis and treatment. So moving on to the impact. So we all know it has a rising incidence in Sri Lanka, and also the number of young colorectal cancers are on the rise. So that is another cause and reason for us to know about this cancer. And as it's a malignancy, we know it's a major health burden to our health economics. So common sites, we talk about the large bowel, such as ascending colon, transverse colon, descending colon, sigmoid colon, and the rectum. So, but the left colon has the most number of colorectal cancers, and it's about 75 to 80% of the time the left colon has most number of cancers. So these cancers, they do not arise de novo, it mostly arises from a pre-existing polyps. And there is a 3% chance that you might find another cancer in one of those cancer diagnosed patients. And there is a 30% chance that you might find another polyp, which may become cancerous later. So moving on to the symptomatology of cancers, the colorectal cancers, most of the patients do present with bleeding per rectum. And the passage of mucus may be associated or not. And often they come with altered bowel movements. So the alteration may be the consistency may be altered, the frequency may be altered, and sometimes they do come with anemia, and there can be acute presentations as well, such as an obstructed abdomen, the bowel, or perforated bowel. And moving on to the diagnosis part of things, always history and examination comes first, and often we do a digital rectal examination, which will help us definitely to find out rectal cancer if it is lower down. But definitive diagnosis is done by colonoscopic examination and biopsy of any lesions. But I told you before that what is the percentage of cancers that we can find in the rest of the colon if you find a cancer in the rectum? It's about, what is it? Yes, 3%. So the colonoscopic examination of the whole colon is very important here, and if you find any suspicious lesions, you have to biopsy. If you have a diagnosis of colorectal malignancy, you have to stage the patient by doing CT scan, and if it is a rectal cancer, you might have to do a MRI scan as well. So apart from that, the tumor marker, carcinoembryonic antigen, is also of concern. Treatment wise, it has to be a multidisciplinary approach. So the oncologist, surgeon, radiologist will have to come into play. And there is a place for neoadjuvant treatment and as well as adjuvant treatment. Surgery, definitely there is a place on an elective basis most of the time, and sometimes on an emergency basis. And there is certainly an endoscopic role as well in terms of therapy. So do we have any questions? I'm sure you all have some questions regarding the topic. Yes, Dr. Usugo?
Questions regarding about this organ preservation in rectal cancer is coming up.
Yes, it is coming up now with the advent of newer technologies and oncological treatment modalities. The sphincter preserving surgeries and organ preserving surgeries are coming on in huge number, so we can expect more and more practice in the coming years. Do you have some more questions?
What is the indication for MRI?
MRI in locally advanced rectal cancers, there is a definite place for MRI that is well proven in the Mercury trial. Thank you for the question. So moving on to summary. There is a rising incidence of colorectal cancer, especially young colorectal cancers, and the left side colon has more colorectal cancers, and the alarming symptoms which patient present with will have to be taken promptly and investigated, and appropriate diagnostic test must be used. And there are various treatment modalities available, and it is potentially curable disease. Thank you very much.
You have made a very clear presentation, and one thing I like is that the good use of icons and images, and you have used appropriately. For example, if you can go back on the one on diagnosis, you can see it. Yeah, it highlights the message, and also the last slide. If you go back, you have used the icons. No, say you can see. Yeah, so that's a good thing, and also the getting the audience engaged. You start with the question, have any of your relatives have gone through this? So that's one way to arouse the interest, because before you start your lecture or presentation, you have to arouse the enthusiasm and the motivation of the learners. Because anyone would have maybe one of their loved ones, close relatives affected by this. So you go back to those memories, so in that emotionally engaged. So that's also important. So that is one way of arousing arousing enthusiasm and the interest. You can do it in many ways. You can ask a question, you can tell a story, you can give a personal anecdote or even a video, many ways of doing it. So that is something very important. Yes. Regarding this what I call the positioning. The positioning is important. Now we have positioned the icon in the correct place. So when you position that highlights the message. Areas for improvement, the objectives again has to be written in the proper way. And your voice was clear, but I would have liked to have more modulation of voice. For example, when you say about multidisciplinary approach, you can highlight, you can raise your voice a little bit, because if you want to give one key message, so what are your key messages? That maybe the regions are found on the left side mainly. That kind of take-home messages, you can highlight them. You can say, this is the most important thing. So those are areas for improvement. Signposting also you have done fairly well. For example, previous year you have discussed this, now I am discussing this. So that's also give the audience fairly on track. It's a good presentation. Any feedback from the others?